In today's video, we're going to be talking about anaphylactic shock or anaphylaxis. This is a life-threatening medical emergency. It's a type 1 hypersensitivity reaction. So what happens is the antigen, which you're allergic to, binds to preformed IgE antibodies which are present on mast cells and basophils, and this causes a huge systemic response and release of inflammatory mediators. So the effect of this is that even within 10 minutes of exposure to the antigen or the molecule which you're allergic to, a lot of the blood which is present intravascularly will move to the extravascular space, so you'll have a huge reduction in blood inside the blood vessels. This will cause a huge and sudden drop in blood pressure, and it can eventually lead to death due to hypoxia. Or another cause of the death is the swelling in the throat, pharyngeal or laryngeal edema, which will eventually lead to suffocation. So here we have the signs and symptoms of anaphylaxis. In the central nervous system, you can have lightheadedness, loss of consciousness, confusion. Some of the key signs and symptoms are what's occurring on the skin. So you'll have urticaria, hives, itchiness, and flushing of the skin. Respiratory, you'll have shortness of breath, hoarseness, cough, wheezing. Gastrointestinal, there'll be abdominal pain, diarrhea, and vomiting perhaps. Now, when we talk about the management of anaphylactic shock, we must remember that there's a huge drop in blood pressure. So we have to first stop the procedure and stop the exposure to the allergen. We have to manage the airway and make sure the breathing and circulation are okay. I'll write the dosages here as well, but we must give an adrenaline injection or an epinephrine injection, and this is the dosages here, and this is a intramuscular injection. We must lie the patient in Trendelenburg position, which looks like this. Oxygen therapy is also given alongside giving antihistamines. However, once the clinical symptoms like the urticaria or the rashes on the skin tend to die down and the patient's oxygen and blood pressure is stabilizing, then we can start to give corticosteroids, and this can be used to help decrease the risk of a biphasic anaphylaxis, so it can stop it occurring again. We can also give a salbutamol inhaler, which might be effective for the bronchospasm, which is one of the symptoms of anaphylaxis, but this is only the case if it hasn't been resolved with the epinephrine, because this can usually be resolved with the adrenaline injection. And finally, just to end the video, the most important criteria in cases of anaphylaxis is for the medical professional to be as prepared as possible. So this means to have all of the medications and all of the equipment available. It's very important in anaphylaxis to work very fast because of the very life-threatening condition and how fast it can progress. So this is key, to be prepared. And the second thing is to have a full medical history of the patient. If you have any suspicions that the patient has an allergy, or if they have any other previous allergies, it's very important to get an allergy test specifically to any materials that you'll be using in the procedures, and this way it's much safer to proceed and avoid any anaphylactic reactions in practice.